Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
5 5-HT3 receptors. In the 5-HT3 receptors, these are ligand-gated sodium and potassium ion channels. These 5-HT3 receptors have action on area postrema, which is actually a vomiting center. The 5-HT3 receptors have action on, they are important in emesis. They are responsible for gut peristalsis, bradycardia. They are responsible for transient hypotension, apnea or itch, and also pain. Okay, because by blocking these 5-HT3 receptors, the drug ondansetron will act, and thus it is an antiemetic, because 5-HT3 is responsible for emesis or vomiting. So as a result, ondansetron will block these 5-HT3 receptors, thus it is an antiemetic drug.
thank you and thank you for watching.